Today actually marks World Malaria Day and is observed under the theme Zero Malaria Starts With Me. This is a disease that still affects millions of people, and in Sub-Saharan Africa, children under 5 still bear the heaviest burden of the disease. Many countries in the region are facing a double challenge of protecting their citizens against existing threats to public health like malaria and then emerging ones like COVID-19. Joining us for more on this is Sherwin Charles, co-founder of Goodbye Malaria. A very good morning and welcome to Morning Live.
Good morning, Valen. Happy World Malaria Day to you.
Thank you very much, and happy World Malaria Day to you and to all of your colleagues that do such fantastic work. Why do we still need to highlight the importance of malaria when currently the world is grappling with COVID-19?
That's exactly why we need to highlight the malaria disease and not forget about it. At the moment, everybody is taken up with COVID. Today is World Malaria Day, and we would like to remind both malaria endemic communities as well as government that the budgets that have been set aside for malaria need to be still in place for us to take preventative and control measures during this disastrous time in our country.
Is there a relationship between malaria and COVID-19 at all? As we saw in the news, there were reports that the malaria drug could be pushed as a COVID-19 cure, but that actually proved to have no benefits.
No, there is not a relationship in terms of the disease. However, you do have a similarity in terms of the symptoms, especially one of the symptoms being a fever. The challenge we have is that in malaria endemic countries here in Southern Africa, you do not want to be self-isolated once you have a fever, believing it could be COVID, without having a malaria test done first. We are a little bit fortunate in that the malaria in this part of the world is seasonal, and we're going into sort of the quiet times for transmission. But malaria will come back as soon as the rains generally come back in the summer, and we could see an increase in malaria from September, October onwards. Our biggest challenge, as WHO said yesterday, we are at huge risk of the number of deaths from malaria doubling during this period.
Doubling? That is incredible and would undo a lot of the good work that you guys have been doing.
Absolutely. And I think our further challenge for us is during this time is to understand how do we still continue with our malaria indoor residual spray program that takes place in Mozambique. How do we do our work up along the borders between South Africa, Eswatini and Mozambique, with us practicing social distancing as well as during the lockdown. Certainly, it'll be seen as an essential service, but we'd have to ensure that our staff are well protected, that our advocacy gets out to the communities to let them know that we will be coming through with our malaria interventions. It's an incredibly important time right now.
Yeah. So how are you guys getting around that?
Well, we're certainly ensuring that we have enough PPE in place. This is not the PPE that is needed by medical staff, but the PPE required when one works with insecticides. There's a lot of planning going on, and of course, we need additional budgets because the normal spray season, as we would carry it out, would be interrupted. We'd have to have a lot more precaution in place. You know, malaria during the height of transmission would normally take up 70% of the beds in a hospital in a country like Mozambique. Those beds would not be available because they would be, it's anticipated they'll be used for COVID-19. So it's incredibly important that our protective measures happen on time and covers total populations.
All right, certainly challenges that you guys are well aware of, but I think you've got it under control. Thank you very much. That's Sherwin Charles, co-founder of Goodbye Malaria, talking to us about World Malaria Day, which is celebrated today. Thank you so much for your time here on Morning Live.
Thanks very much, Valen.